Back pain is a very common condition that we see. It's probably the second most common symptomatic reason for people to visit their primary care doctors. The reason it's so common is because our back is involved in really everything that we do. Every motion that we make, everything we go to pick up, our lower back is really involved.
When you look at it, there's several joints in the back. Each level has 3 different joints, and all you need is one of them to be inflamed. So it's just like spraining your knee, except everything you do requires your back. So you're always going to know that it hurts.
Most times back pain is going to be a benign, limited condition that you don't have to see your doctor for. And most back pain gets better within a month. But sometimes there can be more serious conditions. And those would be the important things to see your doctor about. If the back pain is associated with an infection, or if you're having fevers or chills or night sweats with the back pain, it may be time to see your doctor. If you have a history of cancer, then that would be something that you'd probably want to see your doctor about, just to make sure that there's nothing related with your back pain to that cancer diagnosis.
The other patients that we would be more concerned about are ones with any type of neurological injury. So patients who come in with weakness, persistent numbness, bowel and bladder changes, we absolutely need to see those patients. The other ones that we would want to see are persistent pain, especially pain radiating down your legs or your arms, depending on where the problem is. And then some people talk about pain at night that wakes you up. That could be a number of different things, but one of the things we'd want to rule out would be tumors. When a patient first comes in, our biggest thing is to get to know them as a patient. Why are they here? What do they do? And what are their goals for getting better? What's a successful outcome for them?
We try to identify anything that caused the pain and what the nature of their symptoms are. Is the pain limited to the back, or does the pain radiate down the legs, or is it involved with any other symptoms? That's very important in distinguishing what the cause is and what our potential treatments are. Every patient that we see with back pain does not necessarily require surgery. In fact, most of them may not. The patients that we see are at all different points in their symptom spectrum. So when we see them in the beginning, we always try to avoid surgery and see what we can do for non-surgical treatments.
As far as treatment goes, there's obviously a lot of other things that can be done other than surgery for patients. And in this day and age, we're required to do those.
Some of those treatments include physical therapy, injection therapy, chiropractic therapy, medication therapy, and time.
Additionally, weight loss plays a big role in helping patients out. And sometimes weight loss doesn't get rid of the pain, but it does make them a better candidate for surgery with less post-operative risk.
Oftentimes those are enough to improve their symptoms. If they're not, then we start looking at more aggressive things such as surgery. Back pain is a very common condition that many people experience at some point in their life. There are a few things that we can do to help prevent that problem from occurring. Probably first and foremost would be maintaining a healthy weight. When we have more weight on our bodies, then there's going to be more strain on our backs. The second thing would be good back mechanics with the activities you do every day. So you've heard it before, lifting with your knees and not with your back. And finally, a good fitness program that can strengthen your core muscles can also help with avoiding back pain problems. Patients can refer themselves and give us a call, and we'd be happy to see them. Sometimes we see people right away based on the amount of information and imaging studies they have, but sometimes we do request that another scan may be performed before we see them.
If a patient wants a second opinion or has a known spinal disorder and wants to be seen by one of our physicians, they just have to give a call. Additionally, we have our nurse practitioners who play a big role in this, in helping us see more patients. They see consults. Again, all the consults that are seen by the nurse practitioner are reviewed with us prior to any plan being set forth.
But our bottom line is we really want to try to help people that are suffering from this problem, and we'll do everything we can to get them in as quick as possible to see one of our providers.